Hello, bonjour, Connect Hearing community. How is everybody doing? I truly missed being here last week, so I hope you missed seeing me as well. The topic for today is I will be talking about myths and solutions about asymmetric hearing loss. So I know it's a very specific topic. So if you have any question about a different topic in hearing, you can please add that on the comments below, and I'll go over that with you at the end of this video. So as you probably know, I like to tell stories. I don't know if I'm a good storyteller, but I do like to tell stories. So today I thought about sharing, while we're waiting everybody to join us, I thought about sharing a little bit of the history of Brazil. So I have mentioned in some of my videos that I'm originally from Brazil and I've been in Canada for 13 years. And one of the questions that I get a lot is if I speak Spanish. So you may not know that Brazil is the only country in South America that speaks Portuguese. And back in 1492, Christopher Columbus was a navigator, a pilot. I think he was Italian born. I don't know. I don't remember that exactly, but he, with the Spanish troop, was the first one to conquer a part of America, and then quickly Spanish-born Pope Alexander VI, he created a line. Demarcation line, so anything on the west side, Spain could colonize and explore, and anything on the right side was Portugal. Okay, so that's where was actually Brazil. So quickly Portuguese noticed that was a very rich area, and they found a rich the Brazil wood. So that's how the name Brazil came from, was from the Brazil wood, the trees there. And so for over 200 years, Brazil was the main colony of most important colony of Portugal. And in 1825, Dom Pedro gave the independence to Brazil. But until now, Brazil is the country that has the most Portuguese-speaking population in the world. So hopefully you like a little bit of that story. Hey, Queenie, where is CC? Oh, closed caption. I'm sorry. It will be added afterwards. Okay. Hi. Hello. Hi, Larry. Hi, Larry. So welcome to our 11th week together. Can't believe it. If you haven't been here before, we have been doing these live videos for quite a while. Until now, I mean. And we'll be keeping doing that. It seems a lot of people are enjoying, and I'm helping a lot of you. So if you haven't met me before, my name is Cristiane Basilio. I am an audiologist, and I have a doctorate degree in audiology. And I've been working in the field for about 18 years. And for the last 13 years, I've been working for Connect Hearing. So today, if you just join us, I will be talking about the myths and solutions for asymmetric hearing loss. And I said in the beginning, if you have any question about another topic, you can definitely add on the comments below. Okay, so to start this video, I want to mention, I have a question for you. If you know what is an asymmetric hearing loss. So in audiology, for hearing loss to be considered asymmetric, we need to have a significant difference between the hearing level between the 2 ears. Okay. And if that's the case, before we discuss about any type of a solution for your case, it's very important that you go and see an ear, nose, and throat doctor, because you might need to do some other tests, an MRI, a CT scan. They need to rule out if there is any maybe surgery in your case, or perhaps a different medical treatment than a hearing aid, okay? So once you see your doctor, you will be able to come back to us, and then we can talk about different solutions for your case. A common causes of asymmetric hearing loss is for example, sudden hearing loss, a Meniere's disease, some congenital hearing loss, you're just born with that, genetics, some unknown causes, some noise exposure hearing loss. So for example, the if you're like, you know, hunting, shooting, so that can cause, of course, the big difference between the ears. Okay. Hi Yogi, hey, oh Yurja, nice seeing you. So what we're gonna be talking now is the myths of asymmetric hearing loss. Okay. So I thought about using that white paper again, because I think it's easier for you to see the full sentence that I want you to keep in mind. So the first myth is, I'm okay, my hearing loss is only bad in one ear, and I can get by with one ear. So why this is a myth? So I probably have mentioned quite a few times in some of my videos, but our brain relies a lot on the input sound to interpret the sounds, okay? So if you don't get that stimulation in both ears, a lot of things is missed. When you don't hear in both ears, it's very hard to localize the sounds, and that affects not only how you understand speech and noise, but also is a risk, a safety risk, because if you're a pedestrian or if you're a cyclist, you need to be aware where the sounds come from. You need to be aware how close that maybe the bike is close to you, or a car, and so on. So it's definitely a safety risk there. Also, not hearing in both ears can also affect some physiological process. So for example, how you hear different the volume of both ears. So because of course once one sound gets to one side, it won't get the same volume in the other side. So you need to have that both ears to perceive that difference in volume, and also affect some of the central auditory processing as well. For example, one is for your brain to process two different type of sounds at the same time. So all of that can really affect how you can communicate and understand speech, okay? So what is our second myth? So our second myth is, I only need a hearing aid for my bad ear, okay? So this is, again, is a very normal myth. When you have such a big difference in the ears, in the hearing levels, it's very difficult for you to know if your good ear is actually really good, okay? Because you rely on that ear so much that you feel that it's good, that you have no hearing loss. But it's not always the case. So sometimes when you one side is much poorer than the other side, you could also have some hearing loss in your good ear, and then you might need hearing aids for both ears. Another myth that when you feel that you have a bad ear, you only need hearing aids for that side, is because when we do your hearing test, we're gonna see if that bad ear can still understand and process words, and if it can't, unfortunately, a regular hearing aid in that side won't be helpful. Okay. However, there are solutions for that, and we're gonna talk about it. Okay. What is our third myth? So our third myth is, I can't hear from one of my ears since I was a child, and nothing can be done about that. So this again is a very normal myth. Unfortunately, in the past, we were not aware how important it was to hear in both ears. To diagnose hearing loss in the past was definitely harder as well when you were a child. It would take longer. And we had this concept that when we, at least if you could hear one side, you would be fine, okay? Yeah, you might get by, but now you know already from my explanation how important it is to hear in both ears. So yes, there are some solutions there to help you, even if you have a hearing loss in that side for a long time in one side, what we call as a single side deafness. So that means one ear you hear perfectly and the other side is completely deaf. Okay, so there are solutions for that as well. Okay, that we're going to be discussing about it. So that's good. So let we be talking. I don't see any questions there yet, so I'm gonna keep going, and then you can add the questions later if you need. I will be talking now about the solutions, okay? And to talk about solutions, I will be going over 3 different scenarios where you have asymmetric hearing loss. So if you just join us, we are talking about when there is a big difference between the ears in hearing levels, and some myths and solutions about that. So the solution, the first scenario is when you have a hearing loss in both ears, but there's a big difference between them. But when we test your poor ear, you are still able to understand speech in that side. So perhaps you are not able to understand 80-90% of the words, but you maybe be able to understand 20-30% of the words. So we don't expect with that poor ear that you will be able to understand speech very well, but the combination of the both ears working together is definitely helpful, okay? You will get the benefit of the binaural hearing, as I explained in the beginning. So how better you'll be able to localize the sounds, how better you'll be able to interpret different type of sounds at the same time. So all of that can be very helpful when you're communicating, especially when there is more noise around you, okay? Another important thing is if we don't stimulate your bad ear, over time the deterioration is much worse, and it will impact way more in your hearing. So if one side is much more poor than the other side, but we still hear some words in that side, you can still process. 2 hearing aids, just regular hearing aids, would do the trick in most of situations. But if you still have a lot of difficulties in background noise, the best thing is maybe trying the Rogers system that I mentioned to you. So remember, the Rogers system is a hearing accessory where you might have a receiver on the hearing aids and a transmitter microphone, okay? And this system can improve way more speech compared to noise. This situation as well, what I want to talk about when you have that big difference, but eventually in some cases, the poor ear deteriorates so much that you were wearing hearing aids for a long time, but you start noticing that hearing aid is not helping anymore, okay? So sometimes it's just there's after the deterioration of that side, unfortunately the normal amplification with hearing aids is not helpful, and you might be a candidate for what we call as a cochlear implant. So I don't know if you have heard about this word. I think it's something some people think is new. Some people think that cochlear implant is totally invisible, what is not the case. So the cochlear implant is kind of, we give you an artificial cochlea. So it's totally different than the concept of a hearing aid, because we are giving you like an artificial cochlea. I can't explain a different way, but there's some electrodes that are inserted. So there's a surgery that needs to happen, and it's a 1-day surgery, and then it takes a while for them to activate that cochlear implant. And the big difference in that moment from a cochlear implant to a hearing aid is because the hearing aid wasn't helping anymore. You wouldn't get many more benefit. So the cochlear implant can provide you, especially the high tones, the high frequencies that are very important for speech understanding. And I don't think one of my patients that were here last week, she has a cochlear implant, and it has made a big difference in her life, okay? So we needed to go through an assessment and see if you would be a candidate. So that was one of the first solutions there. The second solution, I'm going to be talking this different scenario where when we do your hearing test, so you have a hearing loss in both ears again, but on your poor ear, you already have no, you can't recognize words at all. I think, yeah, I remember, I think Tom, I'm going to talk about you. I remember that. Nice to see you again. So when one side, you have no word recognition. So what that means is when we give you some words to repeat throughout the hearing test, you really can't understand words in that side anymore. So what that means is a normal hearing aid is just not gonna help you, okay? Because the hearing aid will just gonna provide noise and it's not gonna help with the clarity of speech from that side. So those situations is when we usually gonna do a trial with what we call as a Bicross. So the Bicross, they will actually look similar to normal hearing aids, okay? But on the good ear, you have a hearing aid with a receiver, and on the bad ear, you have a transmitter. So let's say my right side doesn't help anymore with hearing aids, so there's just a transmitter in that side. So basically any sound that's coming towards my bad ear is going to be transferred to the good ear, okay? So this cross system, this Bicross in this situation, is not something new. It's something we have for a long time, actually. But as hearing aid technology, the system has improved a lot as well, okay? So in the past, this Bicross, when you needed the two transmitter and receiver, it had like a wire connecting them. And then, of course, improved and then became wireless. But in the beginning, the consumption of battery was quite high, so people had to change batteries every 2 days, where now they even have a rechargeable option as well. So this Bicross has improved tremendously over the years, okay? So for the single-side deafness like Tom, I think that can be a really good idea as well. I know because I already know Tom from all my videos, he has a Rogers system, and that would be my other solution to talk about as well. So if you have the Bicross, but it's still you have difficulty in noise, in loud environments, or here at a distance, you might need to add the Rogers system as well, okay, to help you. Yeah, you see there are solutions. And one thing I want to mention as well about that is important to know the realistic expectations in those situations, okay? When you have a Bicross system or a cross that I'm going to talk about our next solution, you are not able to localize the sounds, okay? So it won't help you with that. So the difficulty in background noise is going to still be quite high, okay? Because you need that input from both ears, remember? So when you have a Bicross, there's no amplification on the poor ear, okay? It's just the sound is being transmitted wireless to the good ear. So that the difficulty in localize the sound is going to still be there, but it can help you a lot. Let's say if you're in the car, if you maybe be in an office setting where there's not a lot of noise, or in a small groups, and it does give you more the awareness of sounds around you as well, okay? Hi Guy, I see you have a question about tinnitus, about the ringing. We can talk a little bit about that at the end, okay? So, oh Fred, I just see you again, nice seeing you. So what is my third solution, my last solution? And Rick Mostad, hey. So my third solution is when we have the single side deafness. That's what Tom had mentioned he has. So it's totally deaf one side and you hear perfectly in the other side, okay? So those situations, it's very much, we do like the cross systems. So you notice I'm saying Bicross and cross. So how they work is very similar. It's just we use the term Bicross when you have a hearing loss in one side and very poor hearing loss in the other side. But we talk about the cross system when you have a totally normal hearing in one side and totally deaf ear in the other side. So it's the single side deafness, okay? So for the cross, you have a receiver. So again, would look like the hearing aids. So you have a receiver in the good ear, no amplification because you don't need that amplification. And then you have the transmitter in the bad ear. So anything that's going to the bad ear is going to be transferring wireless to the good ear, okay? So it's very hard for those patients because they always have to be turning, you know, all the time to hear from the good ear. So when you have the cross system, that can help you quite a bit, because if someone is sitting on your bad ear, you don't need to be turning your head, okay? You will be hearing from your good ear. Again, realistic expectations, okay? Because you are not able to localize the sounds and all those other processes that I mentioned that are affected when you can hear in both ears, there's a lot of difficulty in very noisy places. So maybe the Roger system again, and I think Tom said he has that, can help in more loud situations and hearing at a distance, okay? But I can tell you I've seen amazing outcome from people that didn't think they had a solution for them. And it goes back to one of my videos when we talk about what are your needs, what your lifestyle. So maybe having, you know, hearing loss completely on one side and normal hearing the other side, yeah, you get by most of situations, but you maybe be working in an office and you are constantly not know what's going on around you. It's very frustrating for a lot of people, okay? So, you know, spread the word out there that yes, there are solutions with the realistic expectations, knowing exactly what to expect from how much help, right, you can get from devices. But yes, there are solutions out there for sure, okay? So I think I did go through all my myths and solutions. We will go over some questions there. I like to see all my friends, my virtual friends. So let's see if we have any questions here. So let me take a look. So Fred, he said my left ear is not as good as the right. I have trouble understanding foreign accents, especially British, and people who do not enunciate clearly. Yeah, Fred, for sure. Hopefully you don't have that much trouble hearing my accent. But as you said there, I try to enunciate well. I try my best because I know that's very hard when you can't hear well, and especially if you have that much of a difference in both ears. But if you still understand some words in the poor ear, it's still better to have hearing aids in both ears. And might be the Roger system for you, Fred. It might be a good option if your lifestyle require you being a lot in crowds or in groups. Maybe not so much now during the COVID crisis, but hopefully one day we'll be able to go back to normal life, and that can be a good solution for you. I have a question. Oh, we have one question here. How much of a step difference is required to be considered asymmetrical? So we talk about decibels when we do a hearing test, and that question was from Roger. So Roger, it's about 20 decibels at least of a difference between the two ears for us to consider an asymmetric hearing loss, okay? And yeah, okay, so we have a question from Doug. I think I've seen Doug before from Victoria in my videos. Hi, Doug. How often is the hearing testing maybe to upgrade? Hold on, let me see if I understand the question. How often is the hearing testing maybe to upgrade, adjust the current hearing aids I have from Connect? So Doug, that's a very important question. I would always advise everybody to have a hearing test once a year, okay? So we don't expect a big difference every year, but like our eye test, vision test, we should do a hearing test every year. And if there is any, little change there, we can readjust the hearing aids, okay? Definitely important to go back once a year for a follow-up, okay? So I think the other two questions I had, oh, I have a question from Guy. I think we have some time here if you don't mind. What do we know about ringing sound in both ears, and how can we change the intensity? So first recommendation for you, Guy, is to have your hearing test. I did a video about tinnitus, so the ringing in the ear is most likely called tinnitus, and it's very common you have a hearing loss when you have tinnitus. So definitely first thing you'd have to have a hearing test. And to change the intensity of the ringing, there is some methods there that we use with maskers, and sometimes just the amplification from the hearing aid can change the intensity of the tinnitus as well, okay? And there is some tinnitus maskers as well that can help with that. But I would suggest you to go and look for my video about tinnitus, and I have way more information there for you, okay? So I think that's good. Yeah. Oh, thanks for letting me know, Fred, that you don't have trouble to hear my accent. I try my best, and I'm very conscious about that. Yeah, so thank you again for being here in this video. We hope I can be here. Maybe we won't be here every week. We'll see how it goes. I want to be connected with you. Connect Hearing wants to keep bringing the awareness of hearing loss, and talk more about it. And I actually was very happy yesterday. I was following one of my yoga teachers. Actually, she had a child with hearing loss, and they created an emoji on Instagram. I don't know if you guys here knows about Instagram, but it has the ear with a hearing aid on it. So the more we talk about hearing loss, the more people will understand how to talk with you that have a hearing loss, and be more understanding about the difficulties, right? And so let's spread more about this, hidden disease, I would say, and that affects so much all of us, right? So thank you again for being here. Hopefully you have a really good rest of your day, and stay safe, stay connected. I truly missed seeing you here last week, so hopefully we'll see you the following ones. And that big hug again, and bye. Bye-bye again.